Types of arthritis. What is arthritis? Arthritis is the inflammation of one or more joints. It is derived from the Greek words arthro, meaning joint, itis, meaning inflammation. It is an umbrella term for a cluster of over 100 different diseases that attack the musculoskeletal system. The anatomical breakdown of joint is: a joint is the structural area where two or more bones meet to facilitate body movement. In a healthy joint, a smooth layer of cartilage cushions the bone ends, allowing them to glide smoothly against each other. When arthritis occurs, this structure is disrupted, as by the following mechanisms. Arthritis by mechanical breakdown. The protective cartilage wears away over time, causing the exposed bones to grind directly against each other during movement. Immune attack. The body's immune system mistakenly targets and inflames the synovial membrane, the tough lining enclosing the joint parts. Now let's discuss the main topic: the types of arthritis. Arthritis is categorized into three specific terms based purely on the exact number of joints experiencing active inflammation. Identifying this numerical pattern helps physicians quickly narrow down potential diagnoses, as different diseases present in highly specific joint counts. These are monoarthritis, oligoarthritis, polyarthritis. Let's discuss them one by one. Monoarthritis. Monoarthritis describes inflammation restricted to exactly one joint. In clinical settings, it is treated as a medical emergency until proven otherwise, because a single, highly inflamed joint often points to rapid, tissue-destroying processes. Good medical examples include acute gout. It is a metabolic condition where uric acid crystals deposit sharply into a joint. The classic example is podagra, a sudden blindingly painful attack, isolated strictly to the base joint of the big toe. Second example is of septic arthritis. It is a direct bacterial infection inside a joint cavity, usually introduced through the bloodstream or a penetrating injury. It typically locks down one large joint, most commonly the knee or hip. Oligoarthritis. Oligoarthritis defines active inflammation, localized within 2 to 4 joints, during the first 6 months of the disease. Good medical example include reactive arthritis. It is the joint inflammation, triggered as a cross-reaction to a bacterial infection, originating somewhere else in the body, like the gut or urinary tract. It characteristically strikes 3 or fewer joints, such as one knee, an opposite ankle, and a single toe. Polyarthritis. Polyarthritis is the concurrent, widespread inflammation of 5 or more separate joints. It signals a widespread systemic or autoimmune process that is circulating throughout the entire body. Good medical examples include rheumatoid arthritis. It is the definitive example of chronic symmetric polyarthritis. It targets dozens of joints simultaneously, systematically attacking the knuckles of both hands, both wrists, and the balls of both feet. Systemic lupus erythematosus arthritis. It is an autoimmune disease where the body attacks its own tissues, causing migrating polyarthritis that impacts multiple joints across the body, alongside distinct systemic signs like a butterfly-shaped rash on the face.